So, good morning, everybody. And today marks 324 days since this all started for us 46 weeks ago. Unfortunately, we had 8 Albany County residents pass away. 4 of them happened earlier in January, and you think 11 months into this, we would have the tracking system down, but they just let us know about the 4 that happened in early January, and we had 4 new ones last night. So this all happened in the last 24 hours. A man in his 50s, a man and woman in their 60s, 2 women in their 70s, a man in his 80s, and a man and woman in their 90s. This now brings us up to 312 people, Albany County residents, that have come to COVID-19. My hearts and prayers go out to the families, my condolences, and you're in our thoughts. It's a tough time. I keep hating to have to say this, but the way we say goodbye to people is different than we did 46 weeks ago. And though funeral parlors are open and they're doing things differently, it's still not the same. People want to embrace one another, they want to hug, they want to be there for them, and you can't. So again, please, anyone that has lost anyone, whether it's the COVID-19 or anything else these last 46 weeks, it's been tough on them. So please take a moment and step back and just say a little condolences, prayers, or just keep them in your thoughts. This now brings us to 86 people that have died this month alone. Before this, December was 66, was our highest, and we're at 86. 20 more today than we were last month. In May, just so the comparison things, we lost 55 county residents to COVID-19 in May. As of today, there's 18,191 cases of coronavirus in Albany County to date. That's an increase of 188 positive cases since yesterday. This now brings our 5-day average to 183.4. Yesterday it was 176. There are currently 3,085 people under mandatory quarantine. Yesterday that number was 2,966. Of the cases, 57 had close contact to a positive case, 21 were healthcare workers, 1 traveled out of state, and 109 do not have a clear source of infection at this time. As of today, 53,482 people now have completed quarantine. 16,627 tested positive for the virus and have recovered. That's an increase of 168 recoveries since yesterday. There are 8 new hospitalizations overnight. There was 154 currently hospitalized from the virus. Yesterday, their number was 162. There are currently 11 patients currently in the ICU. That number stays the same, 11. Please continue to wear a mask, cough into your arm, clean your hands, socially distance, and we'll get through this. COVID-19 is not done with us. I know we're fatigued. I know we want to open up that door. I know people joke about Forrest Gump when he goes running. Everyone wants to run out and just get back to the way things were. Things are never going to go back to the way they were. It's a different world we live in. We have to reimagine everything that we did, be it at work, be it at home, be it going out, be it playing sports. Everything's different. And we'll get through it. We just got to be patient. Like I said, it's a marathon, not a sprint. And people just got to take a deep breath because it's about the health and safety of everyone in the community. Please remember that. So, when it comes to issues of allowing high-risk sports to begin February 1st, there seems to be a lot of confusion out there. Some view it either contact sports are not allowed or they're not being able to practice or get together. It's not the case. And it was one of the things I said to the coaches and, the couple school superintendents, and I'm not going to say who they were, called us and commended us for the decision we made. Very happy, a lot of coaches. To the coaches that are being closed-minded, I said, read the guidance that Dr. Whalen sent out to the schools. There's a whole contract in there. In the one paragraph, it's like, that's why I couldn't understand the confusion. We didn't say no to sports conditioning. We didn't say no to people getting together and doing drills. We said there's no traveling, there's no games or scrimmages at this point. But you should be getting conditioned and ready to play. We realize you can't just say, hey, February 15th, things are opened, and, oh yeah, that's right, you have to condition, you have to get healthy. Because, again, if we're worried about the well-being of our children, we want to make sure they're conditioned to play. And that's why I said to the coaches, please read what we put out. Before you start pointing fingers and screaming and hollering, read the guidance. And quite honestly, it was unfair to our health commissioners in the capital region. It was unfair to us that the governor released this unannounced to us without no guidance, without talking to us, and kind of just said, here, you figure it out in the midst of everything else going on. And I've said this before, the safety and health of the residents are the most important thing. For 46 weeks, I've been following the same script. We've been following the same science, World Health, CDC. We haven't wavered, Dr. Whalen and I, on one thing. I don't know why things are changing and we're just saying, hey, open up, do weddings, do this, do that, when our numbers are at our peak. When we've had lost more Albany County residents these last 2 months than we did in 11 months, and more people hospitalized. If you look at the cocktails that hospitals are giving, we're saving more people. I can't imagine if that stuff wasn't there in place. I said that about my brother. If my brother was in the hospital back in May, he would have died. There's no way he would have made it out. But because of the cocktails they could give him and the 5 of them that he had to take to get out, it changed. It was a game changer. They have resources and tools hospitals didn't have early on or 46 weeks ago. So I know parents want to play. I know they want their kids to have their senior year. Trust me, I do too. As a parent of 3 kids, trust me, I do. I want to see that happen. I want your kids to feel normal, but we can't just kick out the science. And you know, if you read the coaches, it's on the first page. We put it on our Facebook too. It's on the first page. So coaches, please take the time to educate yourself. Read it. You want to protest? Please read what's in the guidance first and foremost before you go to your students or your student athletes and say, let's go protest, let's go make some noise. Read it, please. You owe it to yourself, coaches, and you owe it to your players to lead by example and read the guidance. And you know, it says the 7-day rolling average is calculated by the New York State Department of Health, must be at or below 4% in the 7-day rolling average, or percent positive of 4%. Activities must be restricted to individual, distant group trainings or groups, or no low contact group training. So they can get together, they can condition, they can work out, they can do their drills. They just can't do one-on-one drills, and they can't just scrimmage, and they can't play yet. But you can get together and do this. You've been shut down since November. I get it, and there's a month left, and I said this. Kids, you want to play? Go to your coaches, modify your season. There's nothing that says basketball season can't go March to June. That's not what we're saying. Be creative. Things are different. So you couldn't play November to March. Well, maybe now you can play March until June. So please work with us and help us get through this, because we can get through this if we're working together. Also, all 11 of the other counties beyond the capital region had signed on to this guidance. This guidance, actually, that we did, I let Dr. Whalen talk about it because I was not in the room, was written by Saratoga's doctor. This was Saratoga's plan, and everyone signed off on it. And, I will say this. It's not easy when you have people protesting. It's not easy when people are coming to my house and want to protest my house. I say just this. Please be respectful of my neighbors. They didn't sign up for this job. They didn't sign up for this stuff. Just be respectful of my neighbors. It's tough, but I'm not going to fold the pressure. I'm not going to fold the pressure because these coaches are misleading their student athletes and saying, let's get out there. We're not saying no. We're just saying let's be smart about it and let's protect the welfare. I get it. But read the guidance in coaches, and not all of them. There's been a lot of great coaches I talked to, and I don't want to categorize 5% of bad apples that want to mislead their community people. Please, but where's the chanting to open up schools? Where's the chanting to get kids online learning? Where's the chanting to make sure we protect our seniors? Where is all that? I love when we protest. There's nothing wrong with that because it helps educate us and make sure that it keeps us honest. I'm just saying, please, educate yourself first and let's have an intelligent argument. We can agree to disagree, but I assure you, for 46 weeks, I have not wavered one iota when it comes to the guidance. I don't know why other people are, and I'm not pointing the finger, and every county executive or county manager or board of supervisors, that's up to them what they want to do in their respective counties. There's nothing in the science, and Dr. Whalen can say this better than me, and I'm going to turn it over to her. There's nothing that has showed me these last 2 months that's different than the way we've been dealing with it for 46 months. You can't just hit the light switch and go, here you go, people, go on out. Everything's good. It's all good. I wish I could say that. I really do. I really do. Dr. Whalen.
Good morning. So one of the reasons we're here today is to clarify some misperceptions that I think have been put out in the press about a difference between approach in the counties that are listed above. And first and foremost, I do want to say that this was a decision, a meeting was pulled together of the regional county health commissioners and directors, and there was discussion over a number of days. So this was something that we spent some time discussing, spent some time considering. And I will again state that this is really a common sense approach. Can you put up the epi curve, please? We have to continue to look at where we are in terms of the numbers and where we are in terms of the burden. No, the one that, that's not.
That's not the wrong one, average.
That's it.
Nope.
That one. Yep, thank you. So if you look at this curve again, I know I've said this before, but when we had a total shutdown, that was back in when that curve was at the small peak. Please look at the difference between there and where we are now. We are seeing many more cases in the capital region. We are seeing many more people being sickened, and we are concerned about hospitalizations. As I stated at the last press conference, we are starting to see our numbers decrease slightly, and this is something I'm cautiously optimistic about. But in the face of knowing that we have another highly communicable variant in the area, we really need to maintain vigilance and caution. And quite frankly, it is just not time to start opening things up again. I'm very concerned for the people that are outside today because it's freezing. You know, I feel it's unfortunate that that they're here on such a cold day. I agree that everyone has a right to state their opinion, but I think that the parents need to really carefully look at the information they're sharing with their children, and look at what's happening in the community, and look about the message that sometimes we all have to make sacrifices for the greater good. I'm hearing a lot of anecdotal stories. The county executive indicated, and I have received messages from many superintendents who thanked me for making this decision. I have received messages from parents who have thanked me for making this decision, who have shared with me how difficult it is to communicate this to their concern to their children, who have lost loved ones to COVID and are petrified to send their children into a situation where they may place them at risk. I also understand that there are many that want their children to get back involved in sports. Last night, someone told me that they had been approached by a parent who shared that they were homeschooling their child so that they could play club soccer, because they were afraid if the child went to school, they may be placed on quarantine and wouldn't be able to play soccer. This is concerning to me, but everybody is free to make their own decisions. What my decision must be is to protect the health of Albany County residents, and this is why I made the decision that I did, because I knew that there would be a lot of feedback on it, and because we had feedback on it beforehand, we did decide to make this as a joint decision. And I think the way that that's being communicated is different in different counties. So we're not necessarily taking away practice rights, training rights, things that people have been doing all along. It really is, the high-risk, close contact that we're concerned about. There's still a lot of COVID out there. And we are really at a pivotal time. of being able to start to vaccinate members of the community and start to work towards getting back to some aspect of normalcy. And I do think high school sports will resume. I do think there will be resumption of many activities that so many of us missed. There will be resumption of other important extracurricular high school activities as well, such as drama programs and the arts, who are currently also shut down. I have 3 children myself, and two of my children are more athletic, and one was passionate for the arts. And I can tell you that that community is also suffering, not being able to perform and to be able to share their work with others. It's a difficult time. It's a difficult time, but if we look at where we are in terms of the burden of illness, we really don't have a choice at this point. And we have to toe the line. We have to toe the line until we get through the worst of this. So I am continuing to closely monitor statistics going forward, closely monitoring the burden of illness. We are committed to continuing to work with the schools and the school districts on this going forward and informing them and the public with safety in mind. That to me will always come first and foremost. So I'm happy to take questions, but I do want to make a couple of remarks. In terms of vaccine, I think there's a couple of points that I'd like to clarify as well. As everybody knows, we have been allocated vaccine by the state DOH on a weekly basis, and we have been holding Thursday pods at the Times Union. We are very tightly regulated in terms of how we can get the vaccine out, and county health departments have been charged with vaccinating the 1B essential worker population. So at the last press conference, I saw someone made a comment that said, does Albany County not think the over 65 population is important? And I assure you, we have a strong commitment to assist with the vaccination of the over 65 population. We completely and clearly understand your risk, but the allocation of the vaccine has been very strict, and we have been advised that our allocation is to vaccinate the 1B population. In other counties, they have been given a smaller allocation to vaccinate the over 65 population, a percentage of what they receive. We are told that this is because other counties don't have the availability to vaccinate the over 65s in as many pharmacies as we have in Albany County. We also, in Albany County, are lucky to have the mass vaccine site at SUNY. So these decisions are not being made at my level. They're not being made at the county executive's level. They are being made at the state level, and it is our job to follow those, and that is what we endeavor to do. They may change going forward. As they change, this is information that we share with the public. We are also working with the regional hub, still with daily meetings, to try to determine best ways to share information with the public about where the vaccine allocation is going on a weekly basis and where people can get information on vaccination. I completely understand the importance of that. And this is happening real time. So there have not been available communications to us all the time that we are able to share with people. Where is the vaccine? Where can I get it? Who should I call? The Am I Eligible site will lead you to the SUNY site. Our website will release our spots, usually going forward, and we're still developing a process on this, but I'm hoping that we're going to be doing that on Tuesdays, and we'll definitely get that out into the press exactly when that link will be released, so people are able to sign up at the time that the link is released, because the spots go quickly. And as we start to get information about the best way to contact regional pharmacies and others, we will share that information with you. I have to ask for patience at this time. I know that it's difficult for people. I know people are understandably clamoring for the vaccine, and we want to be as transparent as we possibly can to get you the information that you need to guide yourself and your family to the available resources. So please know that that is being worked upon. It is an incredibly dynamic process. All the entities are finding out about vaccine usually during the weekend and then push it out during the week. So it's a quick turnover time in the process to get the vaccine and to schedule people is very quick. So I appreciate everybody's patience with that, and as I said, we're working with the regional hub on honing our process so that information is more readily available. And finally, I do want to say that we continue to see hundreds of cases of COVID every day in Albany County. I am hopeful with the slight declines in the numbers that we're seeing, but we are still here every day reporting deaths of county residents. And I think, as the county executive indicated in his opening remarks, we have to take note of that. We have to consider how sobering that information is. And we have to guide our information and guidance to the public with that knowledge. Thanks.
Thank you, Dr. Whalen, as always, and again for your leadership. It's not easy, trust me, us having kids and making these decisions, because our kids respectfully played sports at different age groups. But just want to talk about the single day percent positive rate. Mary, if you can throw that slide up. I know. So the most recent data at 4.3% positive rate. On the 7-day average, we're at 6.4. And if you look at the whole capital region as a whole, we were at 4.3 on January 28th. The 7-day average so far has gone up to 5.5. We're almost there, and that's the point. If you watch the charts, even though we're spiking, you got to just follow the science. And so please, the state has put good stuff out. I think Bethany Bumping to you puts good charts up in the paper. Read it. That's all I'm asking. Just take the time and just look at the charts and the science. And I just want to remind everyone, less than 2 weeks ago, we had an all-time record of 186 residents that were hospitalized of COVID-19. And on the 4th of January, the COVID death that day, reported 4 new COVID deaths that day on January 19th. Our percent positive rate was 8.4% that same day. And at this point, and I just want people to look at this if you go on the chart, at this point, Rensselaer County was at 10.5%, Schoharie County was at 9.3%, Saratoga was 8.7%, Warren County at 8%. So it's important to keep in mind and remember how bad it was, but also how things been improving. So we hit that peak, we're going down, so you just got to be patient. And that's why I bring the numbers up. If you look at Fulton County, they're like 14%. Montgomery County, over 14. Fulton. We're starting to come down, but you just got to be patient and work through with this. And just remember, COVID-19 is not done with us, but we'll get there. I know some of the things the governor put out yesterday, starting March 15, wedding receptions with up to 150 people or 50% of the venue capacity will be approved by county health departments. We will begin. I'm glad this came out at least a month and a half early. DOH is going to be putting guidance out to our health department, so we look forward to that guidance. And trust me, as a father, that daughter tried to get married last year. We went from May to August, to October. It was a lot of heartache. And some of the guidance we've seen that you may have to have everyone get tested. Which, again, who does the testing? Who checks the positive, negatives? I don't know. So when we get them guidance, we'll get it out. I already know a lot of these different restaurants and hospitalities are reaching out to us. Stay patient. We're waiting for guidance. The state will give us the guidance, and we'll get it out to you. So, again, be patient with that. So I do want to give a huge shout out before I wrap up to the Public Works, or DPW, out in the Hilltowns. They received a New York Capitol Branch 2020 Project Year Award for emergency slope repair on County Route 9. Brad Hollow Road, which was done all in-house. Thank you to the men and women of our DPW. They do a great job in-house. So again, congratulations on that award. Also, please, Whitney Young's always available, 518-465-4771. The University at Albany. I want to say this to the viewers, go on there. There's some sites available. I checked it last night, not unless it filled up, but there are some sites. There are some time slots. So I'm warning you, get on there, because I was surprised you could find some availability, because I know people were saying they couldn't get into April or May or some time frame like that, or March. Please, as always, you can call them 1-888-364-3065, albanycounty.com. As always, our 24-hour sexual assault hotline, 518-447-7716, and our mental health. And we take this serious. This as much as health. It is having an effect on our children and our parents and just people without kids, older people, seniors that are isolated, and not just nursing homes that are isolated at home. I know seniors that haven't gone out since March of last year, trying to do the right thing, trying to get the shot. And I'm glad Dr. Whalen clarified that with our pod. We don't control it. We're told what we're going to do, and this is your bracket. And if you go outside of this, we will fine you $1 million, and you won't get any more vaccine. That's what we're faced with. So trust me when I say that we make sure we try to follow everything for that reason there, because A, I don't need $1 million fine, and B, I don't want to say to the constituents of Albany County that I can't get any more vaccine because we did a group that we shouldn't have done. Also, I know there's some great announcements coming out with that partnership that Mayor Sheen and I did with Mohawk Ambulance, so I look forward to putting that out there. That's going to be huge news going forward. So I commend the governor for that. Thank you, Governor, and all the Department of Health, the state and county, that they're doing. So again, please, we will have the councils for crime victims and stuff available. As always, the hours are up there: 10 a.m. to 2 p.m., 4 p.m. to 6. And 201, which we announced, is not just for that, can help with people walk through the computer sites, find a place to get tested, and do your taxes now. United Way's pretty much wrapping everything in or Pete Gannon's doing everything in 201. Thank you, Peter, for all that. And New York State Hotline, as always. Please stay safe out there. Educate yourselves, to the coaches that did get it, please. It's online. We gave it to the superintendents and coaches first so they could go through it, figure out the logistics before they got it down to the students and everything else. It's all detailed. It's all there, what they need to do. Please do me a favor and just educate yourself.